Sort of by happenstance, got a job in the public health department. And there I learned how to write grant proposals, and eventually, this was starting in 1974. Within a couple of years, I became manager of the dental program and was involved in helping plan and design medical and dental clinics at different public health sites around King County. So even though my training was way different in English and literature and teaching, I learned sort of on the job to be a public health planner and administrator. And in those years, mid-70s, I was the only out gay man in the public health department. Pretty large public health department in a pretty progressive city, but still, there were a few gay and lesbian staff, but for several years I was really the only out person. And a couple of things moved my interest from the programs that I was managing in the direction of sexually transmitted disease and gay health. And probably the spark for that was that I had had some pretty negative experiences in the early 70s when I went for the first time to my own health department, to what used to be called the VD clinic in those days for VD checkups. And without going into the details, I was treated pretty insensitively, and it was real clear that the staff there were not particularly sympathetic to gay people, nor very knowledgeable about gay sexual practices.